Yeah, so there was actually a question from the audience that actually segues really nicely with the next question that we were going to pose. And Usha, we were going to ask you this question. The audience member was just asking about, if they get sick, what's the process of contacting, an IBD clinic in a case of an emergency, or in the case where they're flaring and they're feeling unwell. And then that really is kind of the question that we were going to ask you, which is how are IBD patients who are sick accessing care during the pandemic? And just I'm curious to get you, and then also other panelists' perspective on, the developing kind of urgent access clinics or capacity for patients who are flaring with IBD.
So for us, as I said to you earlier, I've got an email, so patients can contact me through email. They can contact me, leave me a voice message. I'll call them back right away. You also need to understand, if there is no nurse at your doctor's office, then the administrators are working, the assistants are working. Leave them a message. The physicians will call you and take care of things. We'll also coordinate the care that you need. So what I have done is I have spoken to the patients. When I hear from them, I speak to the patient, find out exactly what kind of symptoms they're having. And instead of bringing them in, I have also emailed them a lab requisition to go get blood work done. I have, emailed them a requisition to get stools done to make sure you rule out infections such as C. difficile, cultures to be done. If they're on biologic therapy and I've got concerns about effectiveness of that therapy, I coordinate the investigations with the patient support program to get stools done for fecal calprotectin, as well as get a drug level done, and then manage the patient remotely. In fact, I had a patient just today who has been calling me in the last little while with a flare, just recently started a new biologic and was doing well when she was in induction phase. And then as the induction, then she went into maintenance, she started having symptoms back again. So I organized all of the investigations for her, got the results back today, and we've changed their biologic therapy based on the results that we have from the tests. And that patient didn't have to go to the hospital or need to come in for investigations. And I will contact her again in a couple of weeks' time to see, how she is doing.
And Jen, in the Maritimes, is there urgent access for IBD patients? And recognizing that there are probably some people that live quite far from major cities like Halifax, and how are you guys accommodating those situations?
So we've been running urgent access for IBD for quite a few years now. It looks a little different now, but essentially it's the same thing. So all of our patients are given the phone number for a patient helpline, where they can contact a nurse navigator. We have 2 nurse navigators who take our calls from Monday to Friday. The nurse navigator will, depending upon what the patients need, organize some routine blood work for the patient and get the patient started on what she thinks we may need to do. She'll contact one of the nurse practitioners or the gastroenterologists. We will organize then, once we have the blood work back or the fecal cal back, a call to the patient, and we'll organize, if need be, an urgent visit to our clinic. So the nurse practitioners in IBD in Halifax have been doing urgent access clinics every day since 5 or 6 years. Now we just do it mostly virtually and only bring patients in when absolutely need be.
Excellent. And Joan, I mean, we've had some personal interactions over the past few months to restructure our whole clinic. One of the challenges we had is that many of us, like the adult gastroenterologists, were redeployed. We had new activities. Our call schedules were completely changed. Our ambulatory clinics were canceled. And just kind of curious if you could kind of share some of the experiences and maybe even talk a little bit about the use of ultrasound in helping our IBD clinic.
Yeah, so across the city of Calgary, I think we're over 30 gastroenterologists in the city, and that's across 4 adult sites that exist. And there was a lot of reorganization and redeployment of the medical group. So one of the things that we did at the Foothills Hospital is we actually said that we would support the entire Calgary zone. So that or takes in the entire city of Calgary as well as some of the surrounding areas around it, and that we would offer IBD care to any patient within that zone, no matter who their primary gastroenterologist was. And how we've facilitated that is any gastroenterologist can contact us and say, like, I've got this patient flaring in the community, this is what their blood work is, and I'd like somebody actually to lay hands on them, and we'll facilitate a direct clinic visit to the IBD clinic. And based on kind of what that physician has given us, they can say, like, if you can do an ultrasound, if you can do a sigmoidoscopy, I'd like that investigation. And then they can either say, based on the patient's findings, I'll plan their medical care, or based on the findings, I would actually like you to plan their medical care and at least the short-term follow-up. And so we've been offering that out of the clinic. We see up to about 8 to 10 patients a day through that process, and that's for the entire Calgary zone. The other thing we did was early predictions of COVID were fortunately different than what the reality is. What was early predictions hasn't come, but our early predictions actually left us really quite concerned as to what would be available for staffing in the event that we truly ended up with a broad spread pandemic. So what we did was we concentrated all telephone access and email access through the entire IBD program to one phone line and one email. And the goal of that was worst case scenario, everybody was redeployed. One person could be at home, potentially with COVID themselves if they weren't that sick, and they could run the Calgary Zone IBD program. We've never got to that point, but that is a shared telephone line and email between our 4 nurse clinicians, 2 nurse practitioners, and 2 of the physicians that are associated with the urgent access program, just to ensure that there should have been no break in care if we would have ended up in a worst case scenario.